It's a wake-up call not only for doctors, but it's a wake-up call for parents to make sure that their kids are vaccinated and immune.
After years of little to no issues with measles, two recent local cases that potentially expose people in Sacramento and Placer counties have doctors on alert. Letters and warnings were issued in both counties, warning hundreds of people about the possible exposure.
But we wanted to know what doctors are doing differently now to make sure it doesn't happen again. CBS 13's Adrian Moore has been looking into this, getting answers for us tonight. Adrian?
And Tony and Sharon, the short answer is quite a bit. Officials over at UC Davis Medical Center and beyond tell us they are taking a multi-level approach to boosting awareness. From the waiting areas at hospitals to the dialogue between doctors and patients, they say they're making measles top of mind.
It's on several levels because we really don't want to miss a case because it is so infectious.
It's an all-hands-on-deck approach when it comes to measles awareness at UC Davis Medical Center.
Emails go out, educational conferences, meetings to make sure that people are aware.
That awareness comes after a critical incident last month where a Calaveras County girl was treated for measles and potentially exposed some 200 patients. In Placer County, a family of 3 was diagnosed with measles, with one person possibly exposing others at Auburn Racket and Fitness Club. In both cases, public health officials notified anyone who may have crossed their paths, but so far, no other cases have been reported. Infectious disease experts with UC Davis say changes are being made.
We have signs up in the emergency room or clinic waiting areas. If you have fever and rash and have traveled recently, please let us know. Those kind of signs. There are prompts for when people register for people to ask these kind of screening questions.
And because measles can often present with cold or flu-like symptoms early on, doctors are being encouraged to ask probing questions to help stop the spread.
Ask if they've been vaccinated, ask if there's been any international travel, ask if there's been any contact with sick people with fevers and rash. Those are all things that we would be concerned about.
And to be clear, in all of the recent local measles cases, none of the people had been vaccinated. After a bout of measles, doctors tell us a person gains immunity and are unlikely to contract it again.